Well, we frequently hear from our certified nurses that they just take great personal pride in being able to say that they are an oncology certified nurse. Just knowing that they were able to master the knowledge to pass the examination is a great boost for self-confidence and self-esteem. Having one or more certifications shows a level of commitment to your chosen profession, and many industries look for certification as a marker of someone who is dedicated to being the best that they can be. If you are a nurse, you are a leader, and you can get certified. Don't sell yourself short. You can do these things. Sometimes it's just putting one foot in front of the other, and you'll get there.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by Lori Williams, President of the Oncology Nursing Certification Corporation, which we'll call ONCC from now on, to discuss how you can use oncology nursing certification to grow professionally and develop as a leader. You can also earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks for joining me today, Lori.
I'm happy to be here today, Stephanie.
Well, we're so happy to have you. So to start us off, let's briefly discuss how certification can enhance a nurse's credibility and help them advance on the professional ladder.
Well, Stephanie, preparing for certification can expose nurses to concepts and information that they may not see routinely in their practice. This can broaden their knowledge of current cancer care and prepare them for those unusual and unexpected questions from patients, or having to step into an unfamiliar clinical setting because of an emergency. This can give nurses confidence to feel that they will be able to handle unusual situations.
So nurses can choose to become certified in multiple areas of oncology. What additional benefits stem from multiple certifications?
Well, certifications or certificates in multiple areas of oncology documents a nurse's expertise in those areas, which can lead to professional advancement when an opportunity arises. Having an AOCN certification shows that a nurse has broad expertise in basic oncology. Having additional certifications or certificates in fields such as blood and marrow transplantation, breast care, or radiation therapy shows more advanced knowledge in those areas.
I think it's really a great thing that ONCC has developed some of those additional certifications. Can you just tell us what all of the certifications or certificates that ONCC does have available?
Well, we have the OCN, as I said, which is the basic certification. We have a couple of retired certifications, which nurses that held those certifications when they retired can continue holding, but no new certificates can apply for those. That's the AOCN and the AOCNS. In addition, then we have the CBCN, which is the Certified Breast Care Nurse. We have the BMTCN, which is a specialty certification in blood and marrow transplantation. And we have the AOCNP, which is for advanced oncology nurse practitioners. In addition, we also have two pediatric certifications. One is retired. That's the CPON. And then we have the CFON, which is the current certification for pediatric nurses. In addition, we collaborate with ONS on a certificate for radiation therapy. And we also work with ONS on the test assessment following the chemo-immuno course that nurses take for administration.
Thank you for describing all of those. I think it's really important for folks to know all of the different types of certification that ONCC does offer.
And I would like to say that not all of our tests are certifications. Some are certifications and some are certificates.
Exactly. So certification helps nurses develop skills that are beneficial to their practice, as we've talked about. But it can also help in industries outside of healthcare. How does the knowledge and confidence that an oncology nurse gains from the certification process translate to these outside roles?
Well, having one or more certifications shows a level of commitment to your chosen profession, whether in healthcare or in another field. And many industries look for certification as a marker of someone who is dedicated to being the best that they can be. So when you're looking to partner with an outside industry, often that certification, those letters after your name, gives you more credibility, both in your area of knowledge as well as just your commitment to your profession.
And we all know as much or as quickly as things change in oncology with new therapies that are offered and new testing that's offered for patients, almost how important it is to have that specialty education and certification or certificates to really show that you are keeping up to date on those areas.
That's right, Stephanie. And ONCC carefully looks when they're developing all of their certifications to try to stay as current as possible. We, of course, have to have evidence in literature that shows what the standards are for those new therapies. So it does take us a little time, but we keep as current as the literature.
So how can obtaining certification open the doors for additional leadership and professional growth opportunities?
Well, there are certainly additional leadership and growth opportunities through ONCC. And so by participating in our committees, task forces, and other volunteer positions, nurses can develop skills such as collaboration, communication, consensus building, mentoring, and strategic planning. And these offer you a great opportunity for networking with your peers. There are many institutions that utilize career ladders, and they may require specialty certifications to progress to higher level position. At facilities without career ladders or those that don't require certification, still specialty certification can convey credibility that nurse is very knowledgeable in her areas of expertise. And in addition, in any setting, attaining specialty certification certainly can provide a career boost. Finally, if you want to write articles for publication, it helps to have validated your knowledge in your subject area, and certification can provide that validation. Or if you're planning to continue your education, demonstrating a commitment to the specialty can be helpful when you're applying to a nursing program or applying for scholarships.
All of the things that you've mentioned definitely are showing what those benefits are with having certification or added qualification certificates for nurses. So in talking about those nurses who have gone through and done the test for those certifications, what educational standards are set for them to continue in their specialty knowledge?
Well, certified nurses must be dedicated to lifelong learning. And one of the best parts of ONCC certifications is that recertification by professional education is based on taking an assessment that shows what areas of the role delineation for a competent nurse holding that certification the individual nurse is strongest in, and which are areas where they could use more knowledge or education. Then to get the professional education that the nurse needs to remain competent in that role and certified, the nurse focuses on the areas where she needs a knowledge refresher. This is much more helpful to the individual nurse in knowing what areas would be most helpful to her than just randomly selecting and possibly, as many of us tend to do when we're looking for educational programs, we select the areas where we already know that area. It is good to be stretched to move into other areas and to be sure that you're staying knowledgeable in those areas, even when you're not working in them.
That's a really great explanation. I think that is, like you said, important and a good way to recognize an area that we may not have focused so much on in that interim time between taking the test and continuing that knowledge base for certification. As far as the assessment that you talked about, are there any specific, let's say, caveats about taking that assessment and when it would be best for a nurse who has a certification to take that assessment?
Yes, Stephanie, there are. Any education that the nurse has prior to taking the assessment should be reflected in the knowledge she has when she takes the assessment and therefore in the results of the assessment. So therefore, any education that is taken prior to taking the assessment will not count towards the education credits that are needed to recertify. So therefore, it is very important that if a nurse is planning to attend a ONS Congress or other type of meeting where he or she will be acquiring continuing education credits that might be used for recertification, the assessment should be taken prior to that so that nurse is aware of what areas she will need points in for recertification, and then to concentrate on those and to show that it was knowledge then that she acquired after she had taken the assessment to determine the hours needed for recertification.
Thank you for explaining that. I think that's a really important thing for nurses to remember as they're starting to think about what conferences they might be wanting to attend in the upcoming year. So thanks for explaining that. So ONCC has funded an Emerging Leader Scholarship through the Oncology Nursing Foundation to help oncology nurses attend leadership continuing education programs of their choice. And this scholarship aids oncology nurses by building on the value of their certifications. How would that experience build on a nurse's certification to further grow their leadership skills?
Well, the ONCC-funded Emerging Leaders Scholarship provides up to $1,200 toward registration for a leadership continuing education program. This scholarship is available specifically for certified oncology nurses. So taking advantage of this leadership scholarship to get special education and training in leadership can strengthen the nurse as a leader. We know that people look to certified nurses as leaders, and learning specific leadership skills that are applicable in work and volunteer settings can certainly open additional doors for nurses.
How can it enhance their clinical practice?
Well, additional leadership training can enhance clinical practice by preparing the nurse to take a leading role in clinical situations, such as leading change as new therapies come into their work setting or as new care delivery models are implemented in their work settings. And with certification, you have demonstrated that you have the knowledge to provide excellent oncology care to your patients. So often your peers look to you for leadership in these new situations.
I think another thing that it definitely fosters is mentorship between nurses, and for those nurses who already have their certification and new nurses coming into oncology, whether that's a new grad or somebody who's switching specialty areas. It's just, I think, like you said, that those nurses look up to the certified nurses. And that's definitely, I think, helps with that mentorship piece as well.
Yes, I think that's correct, Stephanie. I think that certified nurses, because of the regard that their peers hold them in, are often looked to for mentorship in clinical situations. And those certified nurses certainly can be mentors to start those newer, less experienced nurses on the road to certification, so that eventually those nurses can build towards becoming certified themselves.
The ONS enterprise, including ONCC, offers oncology nurses a variety of volunteer opportunities to get involved and to give back to the profession. How can these opportunities add to the meaning of a nurse's certification and their professional practice?
Well, the ONCC Board of Directors requires most of its positions to be filled by certified oncology nurses. So we are always looking for certified nurses who would like to volunteer with ONCC and work with us, including on the board. And while it's not required, we do hope that nurses who receive the ONCC Emerging Leaders Scholarship will use some of the leadership skills that they have learned from that scholarship to volunteer for ONCC. Volunteering for ONCC increases your visibility among other oncology nurses and gives you great networking opportunities. You work with other oncology certified nurses from across the country in the various committees that we have. And employers sometimes give professional development or clinical ladder credit for volunteer service to organizations such as ONCC.
Are there any additional volunteer opportunities through ONCC other than what you've already mentioned?
Yes, we have a variety of volunteer opportunities to participate in committees, task forces, and focus groups. And most of the ONCC committee positions, especially those involved in test and illness assessment development, question writing, and recommending the passing score for an exam, may only be filled by certified nurses. So certified nurses have the ability to learn more about the certification process and give back.
That's great to know what those opportunities are for our listeners who maybe didn't know what that might look like through ONCC and are looking to become more involved. So thank you for talking about those. We've discussed how certification and additional opportunities from ONCC are stepping stones to becoming a leader. Are there any other personal rewards a nurse receives from obtaining certification?
Well, we frequently hear from our certified nurses that they just take great personal pride in being able to say that they are an oncology certified nurse. Just knowing that they were able to master the knowledge to pass the examination is a great boost for self-confidence and self-esteem. And of course, they always know that being certified means that they are providing the best possible care to their patients.
Lori, I want to thank you for the information that you've given us today and also for your leadership with ONCC. And as we're coming to the end of our podcast today, there are a few questions that I like to end all of our podcasts with. And the first one is, what are common misconceptions about certification's role in nursing leadership development?
As I think about it, I think some common misconceptions are nurses thinking that they're not leadership material or that they could never get certified. And so if you are a nurse, you are a leader and you can get certified. Don't sell yourself short. You can do these things. Sometimes it's just putting one foot in front of the other slowly and you'll get there.
Great. What's something about certification that's not often discussed, but you wish people knew more about?
People do not often understand the amount of time and effort that goes into making certification tests valid and reliable. It's not just a few people sitting around and saying, oh, let's ask this or let's ask that. We certainly try to make our questions clear and appropriate. We do not try to make them tricky or to trip people up. So I think it's just understanding sometimes how really valid certification is, that it really does show that you know what the qualified oncology nurse should know. I think volunteering for ONCC committees helps a great deal to learn about these processes. And so I would encourage certified nurses to volunteer for those opportunities and learn more about it.
What additional training or education do oncology nurses need to sit for their certification or certificate exams?
That often is up to the individual nurse what they may need. They may practice in a specific area, and therefore their knowledge across the oncology spectrum may be lacking. And so therefore they should look at, what do I do every day? And then what don't I do every day? It's really important to go to the ONCC test blueprint for the certification that you are intending to try for, and to look at all the different areas, and so know what areas you would need more education in. And that will help you to be prepared. There is no one way to prepare. There certainly are classes that people offer. They are not connected to ONCC and cannot be. Otherwise, our certification could be considered flawed. We don't want people taking courses where it's just teaching to the test. We want to be sure that people really know how to be a well-qualified oncology nurse. So I think that probably the test blueprint is the best thing that will help a nurse know what they need to know to become certified.
And last, what are some additional resources for nurses who want to learn more about the personal and professional benefits of certification?
Well, you certainly can go to the ONCC website, which is www.oncc.org, and find out more information about certification, specifically oncology nursing certification there. There are other organizations that also have more general information about certification. There is the American Board of Nursing Specialties, or ABNS, that ONCC is part of, and that has information about nursing certification in general. Their website is www.nursingcertification.org. And finally, there is the Institute for Credentialing Excellence, or ICE, that is a national group that deals with certifications in many different fields, not just nursing, everything from dentistry to information technology, but they know a lot about certification and credentialing. And their website is www.credentialingexcellence.org.
Well, Lori, like I mentioned, I just want to thank you for coming on and to talk to me today about the importance of certification and how that can help nurses to grow professionally and to develop their leadership skills. So I appreciate all of your information. And like I said, thank you for your service on the ONCC board and just being with us. Is there anything else that you'd like to say today?
If you are not already certified, consider starting on your personal path to certification. If you are certified, stay certified and consider volunteering for ONCC. ONCC is here to help you advance in your profession and your career and to help you become the leader we know you can be.
Thank you for joining me today, Lori.
Thank you for having me, Stephanie.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.